folks. Thanks for joining. Today, I'm just going to go through some slides to do a quick update on the Women-Centered HIV Care Hub and provide some information for anyone who's interested in joining or folks who are part of the hub that are looking to learn a little bit more. It's June 10th, 2024, and as of right now, I am the central coordinator for the Women-Centered HIV Care Hub. My name is Jill. I use she and her pronouns, and I can be reached at jill.cable, K-O-E-B-E-L, at wchospital.ca. And in the coming months or weeks, I will be transitioning out of the main coordinator role, and the main person to contact will be Logan Kennedy, and her information is available on Basecamp as well. To start off, I just want to acknowledge I'm joining you from Treaty 13 territory today with the Mississaugas of the Credit First Nation and what is now known as Toronto. But we have staff and members of the Women-Centered HIV Care Hub situated all across Turtle Island. And I just want to take a moment before we begin to recognize the lands that we're all joining from virtually and to reaffirm our commitment to Indigenous women living with HIV, both within the hub and in all work that we do. So the main goal of this session today is a few things. One, to provide some information to people who might be interested in joining the hub in the future. If they come across this video, we'll maybe see if we can upload it to our YouTube channel to introduce to the hub's mission and activities and sort of what the status of things is at June of 2024, to answer any questions after the presentation's done from any current or prospective hub members about any of the hub activities, and then to provide a space for sub-hub co-leads or members to share progress. And I have a slide at the end that kind of has a one-sentence update on what all of the sub-hubs are up to. And then the goal will be to plan and discuss some of the hub-wide priorities for the upcoming months. So to start, what is the hub? What is the Women-Centered HIV Care Hub? And it is an initiative dedicated to creating a feminist network of people involved in the gender, HIV, and STBBI movement in Canada that are interested in actively confronting misogyny, patriarchy, and historical and ongoing colonialism. And so the goal is by uniting stakeholders from across Turtle Island in the field of women in HIV and STBBIs. Our mission is to strengthen knowledge mobilization, which is often sometimes known as knowledge translation or knowledge sharing, and to empower the full potentials of all people involved in the hub in moving this work forward. Our overarching goal is to enhance healthcare outcomes, to eliminate gaps, and to improve the quality of healthcare for women living with HIV and other STBBI. This is the structure of our hub. So importantly, at the middle is the Women's Community Leadership Team. This is a group of going on about 50 women and gender diverse people living with HIV who are at the heart of all the activities that we do and inform all of the decisions that are made. From here, there are two other main leadership teams, the Futures Leadership Team, which involves all early career researchers, trainees, community leaders, and really anyone who wants to learn how to lead or build leadership capacity. In addition to the Quad Leadership Team, which has 4 people representing the 4 main sort of leadership groups that are within the hub, which is community members, clinicians, community-based organizations, and researchers. And this group is then circled by the co-principal investigator team, which are essentially folks who represent each of the sub-hubs as the co-leads, as PIs for this team. And then we have 8 sub-hubs over here, 5 regional sub-hubs, and that's from British Columbia, Alberta, Saskatchewan, Manitoba, and Ontario, with a new expansion coming hopefully in the next few months to Quebec, and then also 3 population dedicated sub-hubs. So the Black or ACB Women sub-hub, Trans Women and Gender Diverse People sub-hub, and the Indigenous Women sub-hub. And all of our work is guided by our Elder Sheila, based in Kamloops, British Columbia. You can see here that the diagram shows these leaves coming out from Elder Sheila's circle to really encapsulate the entire hub to make sure that we're doing our work in a good way. So for communications, we've really stepped up our game in the last little while when it comes to communications for the hub. So we now have a bi-monthly newsletter. The most recent one just went out in June 2024, and will go out again in August of 2024. We also have a YouTube channel where we upload any talks that are given as part of the Women-Centered HIV Care Hub. They've been happening on Fridays, and so we upload these here. Coming soon, we have a summer student, Sia, who's working on a great website for us too, that will be finished by the end of the summer. And then the goal is to expand into social media, with the first priority being LinkedIn, and then potentially others as we see relevant. There are 5 objectives of the hub. And so the first is to develop a women-centered HIV care curriculum. The next is to organize knowledge mobilization events, sharing the model and other relevant models of care. The third is to create an online repository of research, resources, and support related to women and gender diverse people in HIV. The fourth is to prioritize training and mentoring the next generation of researchers, clinicians, and community leaders. And then the last one is to plan for scale up and sustainability post-funding period. So I'll give a brief update on how each of all these objectives is going. So for objective 1, curriculum development, sort of as a side project to the hub, we've created something called the Women-Centered HIV Care Pocketbook, and it's currently in the prototype phase. We're doing some interviews with women living with HIV, community-based organization workers, and clinical service providers to find out how we can fine-tune this resource. And the goal would be to implement this in a future study sort of under the umbrella of the hub as a resource for women to use for self-advocacy and patient-provider communication. And there's also an interest in applying for some additional funding to carry out a women-centered HIV care curriculum for healthcare providers and to pilot that in some the community-based organizations and clinics in Ontario. And we're looking either in the summer or the fall of 2024 to get this work started. For objective 2, related to knowledge mobilization events, some sub-hubs have already started to plan these. One example is the digging deeper into the women-centered HIV care model virtual presentation being done through STEP, which is the STVBI treatment education program for Saskatchewan. This event is being run through the Saskatchewan sub-hub this coming Wednesday. And this is just an example of some of the events that have been planned. Other options for KM events include doing presentations for community-based organization staff, trainings for those staff, presentations for community members, community events that are social or arts-based, for example, creating a video, infographic, interview, or any other form of media, and then doing any kind of collaboration with a women's program or event at an ASO or elsewhere. These are just some examples of things that the coordinators of each of the sub-hubs have been shown as examples to get started for KM. For objective 3, which is creating the centralized repository, there's a summer student named Kayla in British Columbia who's doing a current environmental scan on current services available from a women-centered lens, and that the repository will likely be housed on the hub website, but it's TBD. We're hoping to maybe do some connections with pre-existing repositories online just to kind of reduce the overlap, but to really make sure that the repository has a women-centered focus, which is something that would be unique to the resources that are currently available. And on Basecamp, there is a little presentation uploaded under the BC Sub-Hub meeting minutes that goes through Kayla's project for the summer. And then for objective 4, which is focused on training and mentoring, so far over the last 3 or 4 months, we've been doing these Friday sessions that are hub talks, 4 different types that are mentoring future leaders. There's a drop-in or collaborative space. And then that's week 1 and week 3 related to the futures leadership team. So for week 1, we've had some mentors come in, people who are farther along in their careers to give some advice. Those have went really well. We've had a lot of them been recorded and put on YouTube. And then for week 2, we have frameworks, values, and rights focused on key frameworks of the hub, like intersectional feminism, which is coming up this Friday, as well as community-based research and other relevant frameworks. And then week 4 has been called the on-air talk, so activating equity in health research. We've had 2 people from several sub-hubs come and answer some questions about health equity and what they envision to be the next steps towards health equity. There's some exciting changes potentially coming into the fall of next year, where these may change into a more clinical focus for providers. And there is some exciting information about talk specific for community members that will be coming in the next few months. So we're excited to see that happen. So here's some examples of the talks that have already happened, that have been uploaded to YouTube. And so if anyone who's watching this is interested in hosting or being part of any talks, reach out and we can certainly get that organized for the fall or winter of next year. And so for each of the sub-hubs, these are sort of at every sub-hub meeting and coordinator handover, these are the deliverables that are shared. So some things related to building the team, doing some stakeholder mapping and building relationships within that specific population group or region, creating some documents like a strategic plan, a work plan, or a terms of reference, starting to do some knowledge mobilization with community-based organizations with a focus on doing an evaluation after the fact, And then there's always the option for some sub-hubs to expand for additional grants to carry out specific projects or ideas that they have. And this has happened for a couple different sub-hubs have started to look into this. And the goal really is for sub-hubs to sort of, and any hub member to take these objectives and you can expand them, you can make them your own. And we're really here to support you in whatever way possible in achieving what you think is important for your specific group. So to just end with a quick update from each of the sub-hubs and the leadership teams, for the Ontario sub-hub, we have a lovely summer student, Delisha, who started with us today. She'll be helping out with the strategic plan, the terms of reference, and some knowledge mobilization events as we transition this Ontario coordinator role as I go to lead the team. Then in BC, we have a coordinator, Zoe, who's been hired, and that position will be split with a community co-coordinator, and that position will be shared once that posting is live for community members to apply to. They're working on the strategic plan. In Saskatchewan, the hiring is underway. In Alberta, a coordinator is hired and the strategic planning is already underway. In Manitoba, the coordinator has been hired and the handoff meeting is coming up soon to help support in the next steps. Quebec is a new sub-hub that we're looking to engage in the next little while through some hopeful supplemental funding from WHRI, and that group is coming together in July. For the trans women and gender diverse people sub-hub, the coordinator is there and they're submitting for an additional new CIHR HIV CBR grant using the strategic plan. For the ACB sub-hub, the coordinator's been hired and the strategic planning is underway. And for the Indigenous sub-hub, hiring is underway as well. And then for the Futures leadership team, the monthly navigating sessions on week 3 are going well, currently working to plan towards the fall. And then for the women's leadership team, the strategic planning is underway and there's a planning for a KM event in the coming months. And then the last slide I want to share here is that we're doing a similar sort of info session, Q&A session for any community members who are interested in getting involved in the team. This will be run by Asha and Esther, who are the community leadership and research coordinators at Women's College Hospital, and who also function as the co-coordinators for the women's community leadership team. So this session is completely open to any community member who wants to learn more about getting involved in the hub, where they can ask any questions and find out information right from Asha and Esther. There's a registration link that can be accessed there. Please feel free to share this with any people you think might be interested in attending. And it's from 6 to 7 p.m. Eastern Standard Time on Zoom on June 13th. That's the end of the presentation. Thanks so much for listening and getting an update on what's going on with the hub at this time. And if you have any questions, please feel free to reach out to me or to Logan once I transition out of this role. Thanks.